Okay, we are joined now by Allison Brinkley. Hi, Allison.
Hey, how are you? Thanks for having me.
And now you work at Liberty Home Care and Hospice.
I sure do.
I would follow that your degree would be in something like that. Now, tell us a little bit about Liberty. That's not a company that's based in Aiken. It's actually a regional, right?
They are. They're based out of Wilmington, North Carolina, but we've been here in Aiken about 7 years. They bought out Hitchcock Home Health and Hospice about that time, and Hitchcock, of course, was based here. So a lot of the staff that started there at Hitchcock, we still have. So in essence, we're still local.
Okay, and it's not a retirement community per se, where you have residents that you take care of. You actually are going out to people's homes.
We sure are. We sure are. We do have an office off of Pine Log, but our office for the most part is our car and going to people's houses. Home health care actually is a benefit of Medicare that started in about 1966. So Medicare patients can pay little to nothing for us to come out to their home to offer physical therapy, occupational therapy, nursing, medical social work, and even aid services.
So from a standpoint of going out, how do you find, they're not patients per se, but in a way I guess they would be.
They are. Typically we get referrals from either doctor's offices or hospitals. If somebody has recently been hospitalized or has had surgery or maybe a recent fall, those would all be appropriate patients for us. So their doctors will get in touch with us, and then we go out to evaluate them and then determine our care plan.
And you're dealing with seniors. Do you actually go out, or? I
do not. My title is the liaison, so I'm the person that makes the rounds in the hospitals to the doctor's offices to educate the staff, to let them know that we are out there, so that they, when these patients kind of come through their doors, they think, oh, well, I remember Allison being here and talking about those services, and I think that they would benefit. So sometimes they'll call me and I can come in to talk to the patients, but for the most part, they'll call the office, and then our other clinicians will get in touch with them at that point.
So how many employees do you actually have?
We have about 20 at this point. So. Okay,
so it's not a small staff by any means.
No.
How many patients does the company have?
Company-wide, I'm not real sure. Our current census is about 65 to 70, but that changes. We are an interim in-home assistant, so our patients usually aren't long-term. It's anywhere from about 5 to 6 weeks, so of course those numbers change.
Right, it can go longer if need be, but one person stays with one person and takes care. So 20 people, it would be awfully tough for 20 people to be in 3 or 4 homes at the same time.
Exactly.
So it becomes more of an individual type thing that it changes, like you're saying.
Right.
You get different people. Okay. Well, give us some of the things. What are the programs that you do? Let's start. We'll probably not finish it right here in this segment.
Okay. Well, like I mentioned before, we offer physical therapy and occupational therapy. Our physical therapists especially, we've got different programs that, like I mentioned before, if we've had a recent fall or if there's just some stability issues in the home, that we can evaluate to see what kind of exercise programs that we can do, or if the patient's recently had a stroke, the occupational therapist can come in and work with hand dexterity and arm strength to help them maybe get dressed or just to be more independent in their home.
And then that would be somebody who goes around to each individual, so that's not somebody that is individual, the person who stays with them and goes into the home, it'd be somebody else.
Right. For instance, let's say our physical therapist, their caseload may be 5 or 6 patients a day. So each patient may see the physical therapist once or twice a week. So they just make the rounds to see everybody that's on their caseload. Okay.
And so physical therapy obviously would be something that, from a standpoint, people get caught up in a problem and laying in bed and think, I'm never going to walk again.
Right.
That may not be the case.
Right. And that's definitely where we can come into play, that if, in order to qualify for our services, you have to have a difficult time getting to and from your doctor. So that's exactly why we're so good, that we come to the comfort of your own home, work in your own environment, and to get you back up and on your feet so that you can be independent and healthy.
Okay, that's very good. Well, we're talking to Allison Brinkley, and we're going to take a break. And when we come back, we'll talk a little bit more about specific programs that they can do to help you in your home care through Liberty Home Care and Hospice when we return right here on Talkback Live. Welcome back to Talkback Live. We're talking to Allison Brinkley from Liberty Home Care and Hospice, nationally recognized, right?
We are.
What are you recognized for?
Just recently we were named one of the nation's Home Care Elite, which means that there's a overseeing organization that goes through our accreditation and goes and determines how our patient care is, or patient satisfaction, and just our delivery of services. And there's roughly about 33,000 agencies across the country, and we are one of the few that has been named elite. So it's kind of nice to be able to offer nationally recognized care here in our backyard.
Yeah, and that's a good award, and certainly good to know. Let's talk a little bit about hospice.
Okay.
Hospice, of course, has the negative connotation in the sense of it means that somebody's not going to stick around for very long.
Right.
What is that like?
Okay. In order to qualify for hospice, you have to be diagnosed with a life-limiting diagnosis, whether it's congestive heart failure or COPD or maybe even cancer. Like you said, unfortunately, hospice has gotten that negative connotation, but I think it's just a lack of understanding about what it really is. And too often, we call hospice in too late before a family and a patient really can reap the benefits. We provide chaplain services, medical, social work, nursing, and aid services, but probably the biggest and coolest thing about hospice is we are able to provide volunteer hours. And volunteers can visit with the family, they can visit with the patient, they can help arrange trips if the family wants to go out and about and they want to take the patient with them. Because hospice really is all about quality of life and enjoying what time you do have left. So you don't have to be stuck and poked and prodded and, you know,
and just
that's
sitting
not fun.
around waiting for the end.
Right.
That's true. I'm sure lots of people have heard the Make-A-Wish Foundation. You actually have a program called 5 Wishes.
5 Wishes. That's a nationally recognized program as well, and our chaplain is excellent. He goes around to different senior groups and churches and different facilities and actually facilitates the discussion. And what that actually covers are our advanced directives. And that just means that if you are unable to speak for yourself, your loved ones really know what your final wishes are. And by final wishes, I mean whether or not you want to be put on life support, if you want to donate your organs, if you know, whatever your final wishes may be, it's there in writing.
Do you provide an attorney that can come in and talk to them about wills and things like that?
There are attorneys here in town that we have contacted in the past, but as far as 5 Wishes are concerned, you don't have to have a notary, you don't even have to have an attorney help you do that. As long as there's 2 individuals that you witness their signature, then that's good as gold in the eyes of the state.
Okay. And when you say volunteers, you need volunteers for all kinds of things, I would imagine.
Volunteers can do anything from help us with clerical and administrative work in the office to, like I said, going to patients' homes to read to them, to do crafts with them. In the past, we had an older gentleman who all he wanted to do was fish, and he wanted to fish with his grandson. And it took us a while because as soon as we scheduled a visit, of course, he started getting sick again. And eventually we got him out, and it was thankfully to one of our volunteers that had a boat, had a pond, and took him out with his grandson. And it was probably about a week later he passed away. And we think that he hung on just to have that experience one last time.
And you know, we tend to think of this WISH program as being these grandiose, go to Disney World or some exotic place, but it doesn't have to be that, does it?
No.
Fishing would be one thing. They may just want to.
They may want to cook Thanksgiving dinner one more time.
Yeah.
You know, go to the beach one more time. Listen to beach music. You know, I mean, anything and everything. So.
Yeah, and just go to the favorite restaurant. Something to that effect, right?
Yep. Like I said, it's all about quality of life and having dignity in your last last days. So whatever that means to you, that's what we want to be able to provide.
When I was visiting your website, I noticed one of them was musical therapy, was something that was a feature, and something that I've done before in my working with a bluegrass group. We would go and play at some of the homes, and it was always a great experience.
It is.
To go and play, and the great part about it was we might be terrible,
Right.
but they always thought we were the
Exactly.
greatest things, and,
Right.
and probably we were pretty terrible.
Well, that's okay, but
but you can get that, and you can do that in people's homes, right?
Exactly. So just because you took the time to go and visit and to share something that you love means the world to people. It doesn't matter if you were terrible.
So you're actually looking for people from all walks
all
of
walks
life.
of life, all ages,
That can
anybody.
volunteer their time because somebody might need you just to spend some time, and it is a nice thing to do.
Exactly.
And
It
go
is.
in and make somebody feel better here, close to the end of their life. And,
Exactly.
you know, they may have months left and a year left, or whatever the case may be. It doesn't matter. They're all
Right.
very, very appreciative of
Exactly.
those types of things. All right. So if you want to volunteer, how do you get in touch with you?
You can call our local office. It's 803-643-0001, or you can check out our website that you've mentioned. It's www.libertyhomecare.com. And there's also not only about volunteers, but there's also some self-assessments that are on our website that if you're not really sure if maybe you'd qualify for our services, or if you think a loved one may qualify for our services, you can go on there and fill out those questionnaires, and we'll kind of point you in the right direction.
Right. And of course, that goes both ways. In that particular case, you're talking about patients
Exactly.
who might need it. And they're, again, the same way of contacting you if you're interested in volunteering.
Exactly.
You can go to the
can go there
website
too.
and go from there. All right. So the phone number again was
803-643-0001.
because that's a pretty easy number
It is.
to remember.
It
That's one of
is.
those numbers where you go, how did they get that
We got lucky.
from that? And it's www.
libertyhomecare.com.
All right. And that's fairly easy too. I found it. If I can find it, you can find it. Well, Allison, we appreciate you coming and spending time with us and talking about something that's not really easy, but you certainly make it easy.
Well, thank you. Thanks for having me. I appreciate it.
I'm sure going to the hospital, that people feel a lot better after talking to you.
Well, I sure hope so. I
Yeah.
sure hope
And
so.
your dad did a good job.
Well, thank you. My mama did too.
Yeah, I was going to say, we probably should give your mom more credit than we're giving, even though your dad was promoting you like crazy.
Well, good. I'll have to thank him later.
Yes, you did good. Well, thank you for joining
Well,
us.
thank you, Ed.
And you're talking about coming back on a monthly basis, right?
I sure would. Just to come back and to give pretty much everybody just some helpful health tips. Every month we'd like to focus on something different. I think next month will be poison prevention, so I'll come back with some good information.
That's good. Poison prevention. You don't want buzzards. Apparently
No,
the
no
buzzards
buzzards.
have poison in them or something.
Something.
I'm serious. That's not a joke. It's what I was being told. All right. Well, thank you, Allison.
Thank
We
you,
look
Ed.
forward to having you back.
Same here.